Welcome to AAPC Social Hour for November 22nd, 2023. And it is Thanksgiving Eve. I see us live, guys. I see us on the Facebook feed.
Oh, good.
We did it.
Yay.
And I've got Lori Cox and Rae Jimenez with me. Hey, guys.
Hey,
Hey, happy Thanksgiving Eve.
I wonder how many attendees we'll have today because is everybody at home getting ready for tomorrow?
Probably.
So
yep.
we'll see. But we have a few people jumping in. Oh, Raven Calvillo from Mississippi and Angelica Bodie. Hey, Angelica. Naya Raman. And people are trickling in, you guys. So I have to ask, do you guys have big plans for tomorrow? I'm looking at Rae and Lori.
Yeah.
We went through this in the last webcast, right?
Yeah. Well, no, just quiet dinner at home. All of our family is dispersed across the country. I don't really enjoy traveling over the holidays. So just a quiet dinner at home.
Okay. Real quick before we hear from Lori, Nic is going to enter right now. So we're going to let him in, and then we're going to warn him that he is live.
He's live.
Yeah. But Jill Beard from Ohio, good to see you. Jackie Zegan from Colorado. Hey, Nic, how are you?
Hello. Hi, Alex. I'm doing well.
I want to warn you right out of the gate that you are live right now.
Yeah.
That's perfect. I'm very excited.
Yeah. We're excited to have you. We're just talking about the big holiday in the U.S. tomorrow, Thanksgiving. Just going to ask Lori. Lori, what are your plans?
Yeah, we are going to have dinner with our family. My stepdaughter's hosting this year, so all I have to do is make sure I can make mashed potatoes without no lumps in them. I should do good at that, but we like getting our family together because we're also kind of all over the place, and with so many kids, it's hard to get everybody together at Christmas time. So, we try to do Thanksgiving and then kind of mess up Christmas a little bit.
Yeah. Well, it sounds like a good time with family and friends.
Very much.
Let's see here. We've got Kiwanis Mitchell. Hey, Kiwanis. Thanks for being with us today. And Karen Hale from Green Brier, Tennessee. Thanks for being with us. For those watching, let us know in the comments what your favorite dish is on Thanksgiving. What are you looking forward to having tomorrow? Nic, you are in Canada.
I've already had my Thanksgiving last month.
Is it similar to the U.S. Thanksgiving?
I think so. Yeah,
turkey and all those things.
We get turkey. We get mashed potatoes, stuffing in the turkey, cranberries, corn, sweet potato mash.
So yeah,
apple pie.
Yeah.
Yeah, I think it's pretty much the same thing across both sides of the border.
Oh, fun. Now, Nic, you're in Toronto, is that right?
Yep.
Okay. And I hear an accent. Like, is that like a French?
I personally don't hear an accent, so I think I'm just used to I'm used to the dialect, but it's not French. I think it's like a specific thing that Torontonians have where we put emphasis on certain consonants.
Okay.
I get it a lot, but I personally don't hear it, and I don't know which consonants.
That's all right. And as you can see, AAPC Social Hour is casual. We just love to connect with our members. We will get to the meat, if you will, the turkey of this discussion.
Alex, that was bad.
That was not a good joke, Alex.
You're gonna make everyone hungry.
Oh, that's right. That's right. Hey, and we have our members sharing what they're looking forward to. Naya ramen, mashed potatoes, and green bean casserole. And Stephanie from Gutenberg, Ohio, thanks for being with us. She says she loves pumpkin pie. So my wife's specialty is lemon meringue pie. She has to make that every year. So
Right.
That I actually had that for Thanksgiving last month, and it was the first time I had lemon meringue pie during Thanksgiving, and it was a 10 out of 10. It was
oh,
amazing.
awesome, awesome. Um, on our Instagram channel yesterday, we posted an image saying, and asking our Instagram community to share or to ruin Thanksgiving with an ICD-10 code. Yes.
To ruin it?
Yes. So we had I'm not a coder myself, so I had to take the
Look 'em
codes and
up?
look them up on Google. So I saw some like belly distress type things, you know. But one funny, super funny one to me was something about in-laws, like trying to get away from the in-law. Or I was surprised there was a code related to in-laws.
It's a common issue, Alex. Why wouldn't we have a code for it?
Right.
That's true. There's a code for everything.
What's
That's
the
true.
code? What is the actual code?
I can't even remember what that code was.
You're gonna have to pull it, Alex.
Yeah, yeah. I'll hunt it down when we get going in our discussion.
Yes, please.
Now, just for our viewers, I've been working hard this morning on awarding prizes. We've had so many great prizes through November for Black Friday. We've been having a contest every Thursday. We've been having a giveaway on different channels. I believe the next contest will be on Instagram. But if you go to the Black Friday landing page, it will share information about where it will be, at what time. But yesterday, or for last week's, we had 15 winners who 5 of them received registrations to RevCon, 5 received a webinar bundle that covers our 2024 code update webinars. And there's another, I can't remember off the top of my head, but we are giving away amazing things. We've given away many registrations to HealthCon in Las Vegas this coming April.
Yay.
So
Excited
looking
about
forward
that.
to that.
Mhm.
Yes. And so just keep your eyes posted and peeled for those coming. We're going to give away some things today as well, but we're going to do that in just a little bit. So I want to kick this off. So this discussion is about AI, and I don't know if Lori and Rae have seen, but just generally about AI, there's been a lot happening this week with
Yes.
people
Yes.
coming and going. And,
Yep.
Yes.
yeah. Nic, how do you does that relate to healthcare AI at all, or is it just
What's happening with OpenAI?
Yeah, and
Yeah.
their leadership and all of that.
So I think it doesn't directly relate, but really what's happening at OpenAI is there's an internal feud or misalignment between a few leaders, and the reason that's important is OpenAI is by far kind of the leading AI company that has these models kind of built out. You know, it's ChatGPT, which I hope a lot of people have gotten some exposure to, and it's important to watch kind of what happens to them because they are at the cutting edge of AI. So it doesn't affect healthcare directly, but it affects kind of the trajectory of where this technology will end up. It might be good, it might be bad. It's very hard to tell, but really, what's happening now is there's an internal power struggle or something of that nature, and they're trying to get alignment back with Sam, who is the CEO that left.
Yeah,
What are the
so interesting.
chances of him coming back, do you think, if you had to guess?
He did tweet about it, like I think yesterday, where there was a tweet where they said OpenAI released this. They're like, we reached a tentative agreement for Sam to come back with a new board. They restructured the
that.
board.
Oh wow.
So I think he's coming back, but then like the next day something else happens and then he's not coming back. I don't know. I honestly there's probably a lot of conversations happening with Microsoft and a lot of the big investors of OpenAI. And it's just a lot of drama this week in the AI scene.
Been very interesting to watch. I have failed to introduce Nic. You're a new face to
Yeah.
AAPC. Before we do that, though, real quick, this is for you, Rae. Z63.1, problems
Okay.
in relationship with in-laws.
Yeah.
There you go. Thanks, Jessica.
Z63.1.
And
I did
see,
find
Nic,
it.
you don't have that in Canada. That's something that we supersized in the US. So
I don't, yeah, I
right
don't think this is in the Canadian coding system.
That's
Uh,
funny.
there's some other great codes in there. Thanks for sharing those. But Nic is the CEO and founder of Semantic Health, who we recently acquired. And I would imagine that our discussion today will kind of follow the story that you tell about your
Yeah.
path and where we're going with AAPC. Nic, would you share a little bit about your history and where you've been and where
Yeah.
you're going?
I would love to. And I would also love to take any questions. I can't see the chat, Alex. So
Yeah.
if there's anybody that has some questions, please let me know.
Absolutely.
But very, very quick background. I don't want to spend too much time on this. I actually started out as a doctor. I was training at the University of Toronto to be a physician. And before med school, I was in computer science. So I was coding very early on in high school, very interested in computers and the power of a computer to help us do things, do more things. That was really my core interest. And the reason I went into medicine was I really wanted to have a large impact on patients and patient care. And the largest impact I could think of was being a doctor. So that's kind of what drove me to med school. And it was interesting because very early on in med school, I realized that technology was also this very interesting tool that you can apply in healthcare and expand your radius of impact as a doctor to not just the patients that you're seeing, but really the entire health system. If you can deploy and digitize things in a very practical but responsible way in healthcare, it can really move the needle on how we deliver care. So I started as I was working in hospitals. A lot of them were paper-based. I don't know how many of you guys have coded off of paper records, but I was the one writing them, and they were not very legible. It took a long time, and it was frustrating to kind of always be writing on paper, and always be documenting things. So I started naturally questioning why we were doing this as physicians. No one really explains to you the importance of your documentation when you're training. And so I had to go figure that out, basically on my own. And that's when I realized what medical coding was and auditing and CDI and all of these important workflows that happen on top of a physician's notes and clinical notes to make sure that our data is accurate. So that's when I got extremely interested in combining technology into the medical coding process, because I really do believe that coding is one of the most critical workflows in a hospital to make sure that our data is accurate. And without accurate data, when we talk about things like AI and kind of, applying AI into the healthcare system, it's not going to work without good data. And the coding teams and the auditing teams and the CDI teams are really the ones that are ensuring that our data makes sense and accurately reflects patient care. So I became very interested in applying technology to improve and really augment how we do coding and how we do auditing and CDI. And short end of it was I ended up starting Semantic out of my last year of med school, so I didn't end up doing my residency, and I never became a full doctor, but I did become the CEO of Semantic back in 2019. And over the last 4 years, that's been our vision, which is to build and deploy technology and software for medical coders specifically, and auditors and CDI specialists, to help them really go through clinical notes and ensure that what is being documented accurately matches patient care. I'll leave it at that. And I will also say we're very, very excited to be partnering with AAPC. I think we both have the same vision in mind, which is AI is really this big, big thing that's moving very fast. And there's a lot of unknowns in it right now. And it's definitely going to impact healthcare. how do we ensure that we are responsibly working with AI and actually introducing it into healthcare and into the coding process in the right way? And that's what I'm interested in. That's what AAPC is also very passionate about, and that's really what's going to be a lot of my focus specifically, working with the amazing team here. So I'll leave it at that.
Rae, Lori, any thoughts? By the way, Nic, that was an amazing introduction and is so interesting to hear your evolution from the thinking you're going to go into the clinical side to the business side. Rae, Lori, thoughts on your guys' end?
Well, he hit on a lot of things that we struggle with day in and day out. I think that one of the things that Nic has shared is physicians just not understanding how their documentation influences other things. And also, I think an issue that we have in the US is we focus so much of the documentation only on payment, and we forget about the patient and all of it, right? It's one thing to reimburse off documentation. It's another to make sure that we've got continuity of care and that we know what's going on with the patient. So things that he hit on really resonate with us, and that's why we are a Nic fan and really like his approach and how he was thinking about AI and the tools that him and his team have built. So.
Yeah, I agree. I think it's interesting too how he's talking about computer coding and medical coding. Because
it can get a little confusing at times if I don't add the medical or computer before coding.
We get that too.
I'm curious about.
I agree.
Go ahead, Lori.
No, I agree. We're really looking forward to this partnership because there's so much out there that we haven't even touched on, and what AI can help with to make coders more efficient at their job. That's where we're going. And you're going to hear this probably several times, and we've heard it already. It's going to eliminate my job. My job's going away. That's not happening. It's going to be better.
Yeah, and I do want to emphasize that point specifically is really it's about augmentation, not automation. Coding is, as I mentioned, very critical and extremely nuanced, and AI systems just are not capable of doing it properly. And you do need to focus on this synergy between you as the coder and a tool that can help you as a coder. In a similar way that you would use ChatGPT right now, that's really kind of the ethos of this type of AI. And especially for, mission critical workflows in healthcare, I don't think automation is coming for these workflows. And I'm really talking more broadly beyond coding on the clinical side, on the operations side, on the coding side. These are all very critical things, and we need experts at the end of the day to be driving these processes. But AI can really help the expert at the end of the day.
Speaking about jobs and members being worried about AI taking over, and it is very clear that this panel does not feel like that is the case, that they will work together. With that, how do we see Semantic Health assisting our members in their workflows? Because in my mind, is it we have Codify, which does that in many ways. What makes Semantic Health different, and how do we see it supporting our members?
So we really focus on how do we take in the two very important pieces of data that you as a coder or an auditor are working with, and how do we analyze that with AI to give you more insights and an ability to work through these data points faster. The two data points that I'm talking about when we're just doing coding, it's the clinical documentation. And when we're doing things like auditing and CDI, it's the clinical documentation plus whatever's been coded previously. And so our systems specialize in taking in this data and looking for signals and signs of codes that can be assigned, of queries that can be sent back to the physician, of overcoding, of undercoding, of opportunities for us to really address the accuracy of our documentation and our coding. And we package up these insights in a software at the end of the day that makes it very simple for you to say, yes, I agree with this. insight, or no, I don't agree with this insight. So it's like um, essentially swiping left or right on suggestions made by the AI, but you still have full control over coding, over auditing, over CDI. So you can essentially add whatever codes you think are missing. You can reject everything that the AI is saying. You can do a mix of both. You can do whatever makes the most sense for that chart. And all we do is add an extra layer of AI into your workflow to really start to surface up opportunities for you to code more codes, identify overcoding, identify undercoding, send queries back to physicians. So it's a little bit different than Codify in that it takes in clinical data, it takes in the coded data specific to patient charts and encounters and admissions, and it starts to give you insights back into those encounters and admissions and charts.
One thing I will say, Alex, getting back to the whole, what does this mean for roles of coders? Yes, coders will be needed, but they would be naive to believe that their role is not going to change in some way. Whenever you're given a tool to utilize, it is going to change certain aspects of what you do, your workflow. It's going to make you more efficient in things, allow you to concentrate or focus on the hardest things that need our attention. I mean, let's face it, there's not enough hours in the day to keep up with the pace and the volume that we already have. So using technology as a tool to get the mundane or the typical things out of the way in an automated or an augmented way allows you to focus on the larger, more complex things that need to be addressed, that humans are needed for.
And one really good analogy I've heard about AI is essentially mathematicians at some point did not have calculators and they had to figure everything out on paper and write down all the steps. Right. And then calculators came out and they could do a lot more math and a lot more interesting math because they now had a technology that didn't require them to do things on paper. So that is kind of how to think of AI in this context, at least how I think of it at the end of the day.
We have a question from Jill Beard. She says, do you feel that the evolution of AI in medical coding will create a gap in new coders entering the field? What kind of education do you see for current or future coders?
Yeah, I do think it's going to be kind of another skill for a coder to learn and another tool for a coder to learn. And especially if you've been coding for, 10 years, 20 years, a long time, it's going to be different than what you've been used to at the end of the day. So there will be a ramp up period where you're gonna have to get in, test it out, figure out what it's good at for you, what it really is not great at for specifically your workflow, and really build that relationship with the tool. That part really we've thought a lot about, and we have experience kind of doing that already with coding teams in the US and in Canada. And there are a lot of interesting ways to ramp coders up and make sure that you guys are comfortable. For the new coders, there's a lot of opportunities to start integrating, this type of training while you're still in school and while you're still training for becoming a coder. And that makes it a little bit easier if you get that training up front, but there's still going to be a ramp up period at the end of the day. So no matter if you're, already in the workforce and you've been coding for a long time, or if you're new and just starting, there's going to be training, of course. And there's going to be training around understanding what this AI does and what it can't do, so that you guys can really build that healthy relationship with the tool. And I think that's when you'll see the most success, is when you do work with it in synergy in your day-to-day, and it doesn't end up getting in your way, and it doesn't end up frustrating you, but it adds a lot of delight and a lot of additional insights into your day that you wouldn't have had. So yeah, I hope that answers the question.
Yeah. Rae, Lori, any thoughts on your ends?
Yeah, and that's one of the things that we're working on at AAPC is implementing or including technology, the use of technology as coders are getting trained, because that is going to be an important job competency. You can't expect someone to learn only on books and then go into an electronic tool. In order for new coders entering the market, they're going to need to understand this technology. I know some of the feedback that we got is it's going to make people lazy. Well, if you don't understand how the system should work, you're not going to understand when it's not working correctly.
Yes.
Right.
That fundamental knowledge and what we know as coders is not going to be irrelevant anymore. It's going to be important to know when technology is not working as it should.
Right, exactly.
One thing I will also, oh, sorry, go ahead,
Go
Lori.
ahead. I was
I was
just gonna
just
say
gonna
that,
say,
like, as an auditor, you know, which is what I do a lot of auditing. I see it working with me, but I still need to have those auditing skills. You know, a computer can't audit and look at something and take into consideration the whole picture of the patient, right? We go through sometimes the entire chart to tell the whole story of what's going on with that patient to know whether this condition is exacerbated or if it's mild or if it's severe. And that's something that we'll always kind of have to do. And so you have to still have those skills and then be able to use AI to help you. Like I use it to look up conditions. If I've never heard of something before, I'll go look it up, and I'd rather
Yeah.
use AI than Google, because Google gives you 100,000, you know, answers, whereas AI gives me one answer and says this condition is such and such. So it's a tool in your toolbox is how I look at it.
Okay.
That's the way I also look at it. And one thing I will say is, as AI becomes more and more widespread, it's not just going to be, you guys are not just going to be using it for coding. You're going to be using it across many aspects of your life. And I think that's really where society is headed, at least over this next decade. Where, you know, it's still very early on, and we haven't seen really too crazy of a change beyond ChatGPT. But I think a lot of these tools will be touching various aspects of all of our lives over the next 5 to 10 years. And you know, even as a non-coder, I think about, you know, what that means for me as, you know, just in my day-to-day life at the end of the day.
Yeah,
Sorry, Alex, I cut you off there.
It's helped. I mean, we're focusing a lot on AI and coding, but when you look at AI in healthcare, look at, you know, patient efficiencies, patient outcomes, what we can do with the data to analyze certain populations, or making just quality clinical care available. But I just love ChatGPT because, man, it used to take me a long time to draft an email and sound good to be
Yeah,
like,
now it takes 10 seconds.
I need this done. Please help.
Right? Me too.
Yeah, and oh, sorry, go ahead, Alex. We keep cutting you off.
No, it's all right. Nic, what were you going to say?
I was just gonna say it's really approaching AI with curiosity about what it can do and what it can't do, and keeping an open mind. The field is still very early, and it's going to change pretty fast. And really just being curious and open. It's going to fail in many things that you try to use it for, but it's also going to be good and helpful for many things, and really experimenting and being curious with it is going to go a long way with making it useful for you, not just for coding, but really for everything.
Terry Holman is just asking, is the AI called Semantic Health? Yes, Nic is the CEO and founder of Semantic Health, a Toronto-based AI healthcare AI company that AAPC recently acquired. We're going to hop into more questions about that, but real quick, we're at the midpoint of our webcast, and we have a few things I want to give away. So today we're giving away 2 HealthCon registrations, 2 RevCon registrations, 5 webinar vouchers, and because our Black Friday theme is rom-coms. Nic, do you know what a rom-com is?
Yeah, I do.
He lives in Canada, not on Mars.
Well,
I've watched a few rom-coms in my day.
Yeah. And The last AAPC Social Hour, I had a few people say, "What is a rom-com?" So
Oh, really?
that's what. Yes.
Wow.
Okay.
Okay.
Now
All
I
right.
understand, Alex.
Yeah. But because it is rom-com themed, you can see our fun videos on our YouTube channel highlighting our love for rom-coms. But we have 5 movie night kits that will have movie treats, some AAPC swag. So we're giving away all of that. I'm going to save the 2 HealthCon registrations for the end of this broadcast. And I'm going to think of something AI related that
I think you should put the names inside of AI and ask AI to pick the winners, Alex.
Oh yeah.
Give them all the names.
Yeah.
And then
Yeah.
say, please
agree with
select
that.
one.
Okay. I like that. I like that. For all of the prizes? That might be fun.
You can do whatever you want, Alex.
Okay.
You're
All
in
right.
charge.
Oh,
Well,
no, don't say that.
Yeah. We're going to start with the everything except the 2 HealthCon registrations. We will do that near the end of this webcast. So here's the question for our viewers. Coders work hard and play hard too. What do you do in your spare time, coders? So share in the comments. I will randomly select later this week. Actually, it might be next week, who our winners are. And I will reach out to you. Let us know in the comments. It'll be, again, a random for those who share their hobbies in the comments. All right, here's the next question for you guys. So before this panel, I think everybody knows Rae, Dan Schwabach, and I had a webcast last Wednesday sharing the announcement of the Semantic Health acquisition. It was amazing to see how many people were excited to embrace AI in their careers, and they want to evolve with AI. And one question that came up from a few people was, will AAPC have an AI credential or certification? And what would that look like? Because I feel like AI is broad and there's so much still evolving in this space. Do we have any ideas of how we will prove proficiency in AI?
So one thing, exciting news that no one knows about, and I might be letting the cat out of the bag, but AAPC has developed an AI in healthcare course that goes over the different uses of AI, benefits of AI. You know, as Nic said earlier, this is still evolving. So to say that it's all fully understood, this is going to be evolving over time. So to train someone how to use AI and say, this is what proficiency looks like, I think that this is going to evolve over time. I can tell you principally from a credentialing perspective, and what our goals are with credentials is to measure job competency. And if using a tool is going to be part of their job requirement or expectation, then AAPC as a testing organization has got to be able to include that in our exams and identifying those competencies. So that could look a few different ways. Could it be something standalone? Possibly. Could it be something that's included in the current exams as we go forward? Possibly. So I can tell you that this is something that we are looking at and trying to find the best way to approach it. It will happen, but at what time and how are the things that we're working through as we learn more about the technology and how competency can be measured using the technology. The AI with healthcare, the AI in healthcare course is going to be available to members next year, and we are including this as a member benefit. So this will not be something that is purchased separately. This is something that we're giving all AAPC members access for. Don't start calling us about it now. Ask me when. I can tell you that we will release it in the member newsletter, and Alex will release it on our social channels when it is available for you to consume. But this is something that we thought members need to understand how AI is being used and all of the benefits and things that are still being worked on to understand it more.
Okay, I love that. For those entering the contest, the responses, any response after this point will not be included in the drawing. If you're listening to this on YouTube or on our podcast, this does not apply to you. Sorry, you got to be here live. Nic, question for you. So we had many members asking in that webcast last week about how can they stay on the forefront of AI? What kind of things can they learn? What places? Where would they go to search this out and learn?
So I've thought about this a lot, and being in AI and working in AI, it's still extremely difficult for even me to stay on top of everything that's happening. And what I've realized is the best way, honestly, is to use it and to kind of be curious, like I mentioned, and to just use it. And if you're using it more and more, you will start to understand it a little bit better and eventually a lot better in terms of what it can do and where it struggles. And I will leave that very generically. Like essentially, if you are searching for something on Google, you can also search for that thing with ChatGPT, and you can compare and contrast. And that is really probably the best way now to stay on top of how these things are changing, because ChatGPT is evolving pretty rapidly. There's going to be competitors that are going to come out if they're not already out. So essentially just have an open mind and use these tools for searching, for example. It doesn't have to be more complicated than that. I don't want to give people too much homework, but essentially, if you're finding yourself Googling something and it's not really working and you're not finding what you want, try asking the AI and try to talk to it. Talk to it like you would ask an expert or a friend. And sometimes that actually gets you better results. So I'll leave it about that. If we want to do another session, maybe later on how to kind of converse or prompt engineer AI systems, I'm happy to talk about that. There's a lot of tricks and techniques to kind of get better answers for whatever you're looking for. But really, my advice is to just use it, and it will change. Your experience will change as these systems evolve. But as you're using it and you integrate it more into, things that are useful for you in the day-to-day, then you'll really stay at the forefront of what's happening in the space. And secondly, of course, keeping an eye out on crazy news like what happened last week. That's not as important, but I think really the important piece is to just understand how it can impact you and how it can help you, and potentially where it's not even helpful for you.
Lori, do you feel like someone who is considering medical coding as a career, do you feel like now is still a good time? Do you feel, I mean, it might be intimidating for someone stepping into this space now with this evolution starting to take off? What are your thoughts on that?
Well, I think any new career is intimidating. So, but we know that healthcare is not going away, obviously. So if you're in the healthcare field, no matter where you are, job security is there, because you might be like me. I started in patient accounts making phone calls to patients to pay their bills. It was awful and I was not good at it. But I evolved my career into coding and billing and compliance and then auditing. And I mean, there's just so many different directions that you can go with it. So, but getting that initial certification or that training, yes, absolutely. It's not going away. And I think we can say that over and over and over. There's so many job openings out there in all fields. And a lot of them are AI related. Now I've seen in LinkedIn, tons of AI coding jobs or coding auditor jobs. And so I definitely now is the time to get in while this is groundbreaking, so to speak, and evolving, because you've got to have those coding skills, like we just talked about, those coding and auditing skills. You've got to have them, even if you're using AI, you've got to have those skills.
I think it would make it an even more exciting job than it is now. I mean, that's one of the things that you hear from people that when people are starting to look at coding education, usually what's prompting them to do so is they've heard that they can work from home. They heard that it's, working on a computer. Well, how exciting would it be to be able to say, you're going to be able to use AI every day in your role to do things better? For me, that
Right.
sounds like a much more exciting job than sitting there coding medical records.
I agree.
That's just me.
No,
You know
I
what I
agree.
mean? If I have a cool tool to use, I mean, when we talk to high school kids about coding as a career, one of the schools gave us feedback and said, when the firemen and the policemen and all these other types of jobs come in and talk to our students, they've got a big, bright, shiny truck or things that they're going to be utilizing every day. Coding to students and young people is boring. You need to find a way to make coding sexy. Nothing makes it more sexy than AI. So
I need a new outfit then,
And-
Rae. If I'm gonna
you need a
And
new
no, I think Rae really raises the great point, which is coding is probably going to be one of the first positions in healthcare where you can meaningfully use AI every day. It's a lot less clinical facing, obviously, than if you're a physician. That requires a lot more regulation and a lot more essentially fine tuning the AI so that it really can add to patient care. Coding is really primed for us to work with AI at the end of the day, and you guys can be essentially the innovators and the leaders with respect to using AI in healthcare. And I find that to be very awesome at the end of the day.
Donna Wagner says, you'll get an answer from AI, but it's all about checking the answer you get, which may or may not be correct.
Yes.
Exactly. So that is called hallucination, and that's a huge issue with AI these days. It can hallucinate. And the reason it can hallucinate is there's no constraint on what you can ask the AI. You can ask it almost any question, and it's been programmed to reply to you, whether or not it knows the answer. And so you always need to be there to check the answer at the end of the day. And then there becomes an art to asking the question so that it doesn't hallucinate as much. And we call that prompt engineering. So hallucination is really a big risk, but there are ways around that. And you still, this is why it's critical to still have a person really working with the AI. So that was a really good question, and we do want to be, I want to be as transparent as possible, but where the shortcomings are of this technology are, because it's critical, I think, for people to build trust with these types of tools, and trust comes from knowing where they don't actually work at the end of the day.
Well, but if you didn't have that knowledge, that base knowledge, this gets back to what we touched on earlier, you wouldn't know whether it was right or wrong. So because Donna has the knowledge that she does, she can spot something that is incorrect. And the whole prompt engineering is a new job in itself. Someone with coding knowledge that understands what Donna understands, that can work with the AI to say, how do we need to prompt this thing to get better? That's a whole new role on its own. And all of the technology companies that we've looked at have coders on staff to help train the tool. Any facility that is implementing an RCM-based AI tool is also using their staff to help with the implementation and the training. So for me, this opens up a brand new career path that didn't exist before.
Rae, question for you.
Yeah, and this is critical. Oh, sorry, go ahead.
And Nic, you can answer this as well. But Rae, talking about ChatGPT, I think that's the most popular AI tool. Maybe I'm wrong, but have you put in codes, tried to do coding work in ChatGPT or any broadly used AI tools?
So in isolation, we've, not put any of our content out there on the public facing ChatGPT. But we have our own instance that we've used to train on our vast content that we have here at AAPC. And we have done testing on it to see how well it can answer coding questions, like for exam questions. Because one of the things that we saw with ChatGPT that was being published was, you know, it was able to pass the bar, it was able to pass other types of testing. So we wanted to see how it would do on our certification exams. And Bevan actually shared this information in his general session at HealthCon. And I know that we've got that recording up, Alex, but he showed a graph on how well the AI answered our exam questions versus others that had already been published out there. I can tell you with iterations of AI that it does get better. And there are certain questions that it does better than others. Like if you're giving it a multiple choice versus a case to code, I don't see it being accurate in coding cases on its own as ChatGPT without any of these other technology vendors that have perfected their or are working on perfecting their technology.
Yeah, and to build, that's really kind of what we focus on is we kind of take what Rae has done and we say, how do we actually integrate this now into your workflow as a coder? We understand you're not going to be answering multiple choice questions, you know, when you're coding charts. So what can we do with these types of AI models that will help you? And that's kind of what our work focuses on. We try to look for essentially we've gotten our AIs to a place where we can now suggest medical codes to you based on clinical documentation. We can take large inpatient charts and summarize them down with key bullet points that the AI has pulled out. We can validate codes for you where we look at codes that have been assigned and pull out parts of the clinical documentation that are supporting those codes. So these are the types of use cases that we experiment with and we build out into our software that kind of ask the question of what can we do for a coder or an auditor in their day-to-day to help them move faster or more accurately or to cover more charts or to kind of dig deeper into a chart at the end of the day. So that's our perspective and kind of like what we do in answer to your question, Alex, as well.
Well, and two, I just want to point out for the Semantic Health tool, it's starting with inpatient. And I don't know about you, but you know, coding and auditing for inpatient, those records are so long. Sometimes midstream in the middle of reading a record, I would forget what the heck did they say 10 services back. And, you know, backtracking and rereading. That's one of the things that I really love about the semantic tool is being able to have the computer go through, the AI go through and get all that information for me and make sense of it so that I'm reviewing it and going back to where the source was. You know, if it was selecting this code, well, why? Well, I can click on it and it's going to show me everywhere in the documentation that instance was supported. So I really think it's a fantastic tool.
One of the questions that I sent to you guys in preparing for this discussion was how can healthcare organizations prepare for the future of healthcare revenue management cycle as AI is used more? I feel like we've covered that in many different ways here. Being, well, one, despite listening to discussions like this within and outside of our industry and trying to involve yourself with tools that are out there that are using AI. And Nic, as you talked about it, about how someone can know more, I sense that you're saying even beyond a healthcare related tool that has AI integrated, just using the widely used AI tools out there.
Yes, it's essentially the analogy I would make is kind of computer programming. You know, when computer programming first came out, it was a completely different way of doing things at the end of the day. But over time, people like now we teach it to our children in schools. You know, in preschool, they're learning coding at the end of the day. I do believe interacting with AI or knowing how to talk to AI will be kind of a skill similar to computer programming. It's going to be a fundamental skill for people in the digital world. So just using it, being open-minded, getting in and being curious about what it can do, and also not expecting it to be perfect. because it's a technology that is still early. We are still in the early days of really AI as kind of this transformative technology. But that makes it exciting, I think, for all of us that are at this cutting edge, whatever industry we're in.
From what I understand, Semantic Health isn't ready for our members to see. It is in a few facilities, and I'm
Yes.
kind of covering a few things. It's inpatient based, but it's not, and also it's not really ready for AAPC members to test drive.
Yeah, right now, and that's partly because of the way that we've been working with our initial customers. We tend to focus on working directly at the hospital level, where we partner with large or medium-sized health systems or hospitals, and we work with their entire coding team at once. So a lot of our work kind of makes sure that we're deploying these systems well, we're integrating them properly with entire coding teams at a hospital or a health system. That's been our traditional focus, but now that we've partnered with AAPC, there's going to be a lot of ways for us to start to bring this technology to members in general. Whether or not you're working at one of the hospital sites, we don't know what that's going to look like, next month or next week, but that is essentially something we're excited about. Rae's very excited about at the end of the day. But that just to answer your question, Alex, traditionally that's been our approach to kind of deploying our technology. Is we pick hospitals that are excited, that are open-minded, that are ready to use this technology, and we work closely with them and their coders and their auditors to make sure that it's deployed properly and responsibly at the end of the day.
And maybe Rae can elaborate more. What is our plan with Semantic Health, Rae, and how and when can our members see it in action?
Oh, Alex, I don't know the date, but as Nic said, these are conversations that we're having. And I think if anything, one of the short-term things that we could do is have a demo of it where, we
Yes.
can have a webinar and have our members see it in live action. At a minimum, we can do that. As far as being able to get their hands on and play with it, there's things that AI needs in order to learn, and a lot of it is vast amounts of data. So to put one record in just to say, hey, let's see what it does, might not be the best representation of how the technology works. So
okay,
I think, just as Rae mentioned, a hands-on demo, an interactive demo is really the starting point when we talk about just introducing new technology into anybody's day-to-day, because that demo will really make it concrete for you guys. What is it actually doing? Where is it going to be in my workflow? So that would be kind of a good next step, as for us to do a demo or a series of demos where you guys can also jump on and ask us questions and, walk through our thought process, your thought process. And hopefully that will make it more visual and more concrete what these tools are doing with the medical coding and the auditing and the CDI workflows.
Okay. We've covered so much. We're on the tail end of our hour. There's a couple of things we need to cover. One, Robin Alvarado asks, hey, Rae, what is the code for sexy coding?
I don't know, but we need one. And I think that's like a t-shirt coming out.
Oh, yes.
Yeah.
Yeah.
I love it.
I mean, we can make up our own code. We can make a new code up,
Sure.
right? Yeah.
I think I might be getting in trouble after this conversation, Alex.
I don't think that's how it works.
And finally, we have 2 HealthCon registrations to give away. We are on the cusp of the season of giving, and we will give away 2 HealthCon registrations to those who leave in the comments. How would you give to others within our industry? Maybe it's at your local chapter, maybe someone in your workplace. But how will you, or how can you give to others in our industry during the season of giving? And it may be someone, a veteran coder, that you could give and support them, or maybe it's a student coder and help them out. Let us know in the comments. We'll pick our 2 favorites, and I will make that announcement. I'll reach out to you directly. I'll reach out to those winners directly next week. So, well, Lori, any final thoughts on your end as we wind down?
No, I think, as we've reiterated several times during this, is the coders are gonna, it's coming whether you like it or not. AI is here. It's not coming. It's here. It's evolving, and we're going to evolve with it. And the jobs are not going away. They're stronger than ever because, as Rae was saying earlier, we've got this new career path, but we still need coders to do this side of stuff too while we're evolving that career path. So there's even more opportunities open for everybody. So yeah, now is the time to get into the field, and I hope everybody embraces it like we do.
Awesome. Thanks, Lori. Nic, how about you as we wind down? Any final thoughts?
Just to echo, it is going to come, you know, whether we're working on it at AAPC and Semantic or another company is working on it, it's going to come, and it's going to essentially transform a lot of industries beyond healthcare. So this is not just coding, it's not just auditing, it's not CDI. Really what we are excited about doing is figuring out how do we make this a success in health information management, in the revenue cycle, and in healthcare more broadly, because that is really critical, is how do we deploy it responsibly? How do we make sure that people are actually getting value from it, and it's making their day-to-day better at the end of the day. And so that's what I'm personally excited about working with. And I'm also very excited to meet you guys, all the members, as many members as I can. There's a lot of members over the coming years, and to really get your feedback and your perspective on what makes it the most useful for you, so that we can build that in at the end of the day, and you know, make the technology as awesome as we can for coders and auditors and CDI specialists, and then eventually people in healthcare in general. So I'll leave it at that, and I'm looking forward to working with the whole community, with the AAPC team, and to kind of really just make sure that this is a success. This, you know, AI in healthcare and the revenue cycle is a success.
Love it. Thanks, Nic. Rae, final thoughts from you.
Just want to wish everybody a happy Thanksgiving. I hope you're spending some time away from work with friends and family. And then just, you know, be open to the possibilities, really is what my final words are. It's an exciting time, and we're going to learn a lot together through this process.
Okay, thank you, Rae. Panel, stick with me as we wind down here. The contest for the 2 HealthCron registrations will end as soon as we go offline with this webcast. So any entries that come in after will not be counted. Again, I see amazing dots here sharing how you can give to those in the industries. Thank you for sharing those amazing things, and hopefully it inspires someone to give during this season. As usual, you can watch this broadcast on our YouTube channel. It will be posted there in the coming days, and it will also be posted on our podcast. If you podcast, just search for the AAPC podcast in your favorite podcast app. And happy Thanksgiving. Panel, continue with me just for a minute, and we will see everybody in 2 weeks. Happy Thanksgiving, everybody.
Happy Thanksgiving, everybody. Thank you for joining.
Bye.